So my name is Fred Davis. Welcome to Mass Climate Action Network, monthly Zoom. We seek to accelerate equitable decarbonization in Massachusetts by empowering local residents, advocates, and community members to take action. Our programming attracts a wide variety of folks, all climate organizers, some who work on municipal light plants, and some who work on better buildings. Just want to mention a couple of our recent programs. Last year, we held a special Leaders Speak Out speaker series on climate justice. And then here's a list of our last year's worth of programming, or almost all of them. So our most recent one at the bottom there was MBTA and climate. So all you climate activists are pushing for more and more transit, but also more and more transit riders. Need to be saying that for years. And today, of course, our talk today is on air pollution and the overlap, crucial overlap with climate action. Everyone is invited to stay on after 1 o'clock. We call it the open network, where we have facilitated sharing. We can continue the discussion on this topic and any others. So the session is being recorded. If you have questions, please hold them until after the initial presentation, at which time you can raise your digital hand. You can find that under reactions to be recognized. And if you're not speaking, please mute yourself. Keep your comments brief, please, and we may or may not be able to address all questions or comments. Again, please rename yourself or put it into the chat, your preferred pronouns and your town or affiliation. I just want to remind, it's 2025. We're in the second half of this decade. We must achieve a significant acceleration in decarbonization. Whatever else is happening, let's keep our eyes on the prize, decarbonize. Thank you. So I'm going to turn it over to Jerry, who's going to introduce our speaker. Thank you very much. Our leadoff speaker, I should say.
Hi, everybody. Welcome. Dr. Philip J. Landrigan says that public health is a tool for social justice. Dr. Landrigan, who's our main speaker today, is a pediatrician and epidemiologist, director of the Boston College Program for Public Health and the Common Good, an internationally recognized expert on the relationship between pollution and disease, and a member of the U.S. National Academy of Medicine. His research examines the impact on children's health of toxic environmental hazards and has expanded to examine planetary threats, climate change, pollution, and biodiversity loss. Pollution that harms our health and the climate will increase without government regulation. What can we do? What can one person do? The answer, demonstrated over 50 years by Dr. Landrigan, is a lot. It is an honor and a pleasure to welcome Dr. Philip J. Landrigan. Please welcome him. Thank you.
Thank you, Jerry. It's good to be here, and thank you all for joining this webinar. So let me go ahead and share my screen here and start the slideshow. Okay, that should be displaying now. So my topic today is climate change, air pollution, and their impacts on human health. And I'm going to make three main points. Firstly, I'm going to remind you of information of which you're already well aware, that climate change and air pollution have very serious effects on the environment, on ecosystems, and they degrade the health of the planet. And I think over the last 20 years, most of the research on climate change has focused on these environmental effects. So I'll rattle through them very quickly. Secondly, I'm going to push the point, and this is the real emphasis of my talk, that climate change and air pollution are not just environmental threats, but they're also very severe threats to human health. They cause disease and disability in infants, in children, in adults, in the elderly, people at every age. Kids are especially vulnerable, as I'll get into, because of their early development. And I would like to argue a political point that if we want to engage political decision makers and the general public in climate change, we've got to bring health into the conversation. It's simply not enough to talk about impacts on polar bears, impacts on whales, levels of CO2 in the upper atmosphere. All of that's important. But if you want to engage the public, you got to tell people how climate change and pollution affect them and their families, their kids in their daily lives. And the health impacts of climate change are multiple. You're quite well aware of these. They all have disproportionate effects on kids. Heat waves are the most obvious consequence of climate change, and the first sign that heat waves were going to be a problem in the new century came in 2003 with the great heat wave that killed so many people in Paris, especially the elderly. And it's estimated that there are 500,000 heat-related deaths per year, even now. This is what's going to happen in Boston. I've got in the upper right part of the graph here, I've got two scenarios. The lower emission scenario is this sort of orange-colored bar, and the red is what happens if we don't do anything about reducing climate change and reducing pollution. The number of days over 100 degrees is going to go up to 15 by 2040, up to 40 by 2070, and up to 60 days over 100 degrees by the end of the century. In other words, the climate in Boston will become like the climate in Phoenix, Arizona, if we don't do something about bending the curve on climate. And then, of course, another consequence of climate change is flooding. This is what happened in New Orleans after Katrina. It could easily happen in Boston. Think of the new development on the South Boston seaport, for example. Wildfires, smoke, increased vector-borne diseases, malaria, dengue, chikungunya fever, Zika virus. All of these will have their geographic extent expanded and their biting season extended as the temperatures get warmer. Food insecurity, famine, and environmental refugees. So that's just a quick rattle through of the health impacts of climate change. Now I want to focus on the work that we've been doing here at Boston College on the health impacts of air pollution. And we define air pollution as unwanted material that's released into the air by human activity that harms human health on the planet. And air pollution is a complex mix of gases and particles. It's not the same at every season of the year. The levels are not the same in every part of the Commonwealth, but the main components are always there to a greater or lesser extent, and they include particulate pollution, which is simply small particles, invisible particles of various sizes, the largest being PM2.10, PM10, the intermediate being the 2.5, and the very smallest being the nanoparticles, also referred to as ultrafine particles, sulfur oxides, nitrogen, ozone, carbon monoxide, lead, and then finally a whole slew, literally thousands of toxic chemicals that get into the air from automotive exhaust, from industrial emissions, the emissions from fossil fuel-fired power plants, and from compressor stations. So climate change and ambient air pollution, outdoor air pollution, are intimately connected, and this picture of a pump check gives you a clue, and that is that they both have their origin in fossil fuels. So fossil fuel, as we all know very well, is the major source of greenhouse gases like climate change, like CO2 that drive climate change. But fossil fuel combustion is also responsible for the great bulk of air pollution, for 85% of particulate pollution, and for pretty much all the pollution by oxides of nitrogen and sulfur. They all have negative impacts on human health, and they all disproportionately affect the most vulnerable people among us. Ambient air pollution kills about 5 million people per year. The death toll is increasing. The worldwide average is that it decreases life expectancy by 1 year and 8 months. But in some places like India, where this photograph was taken, it decreases life expectancy by as much as 4 years. And in a country like the United States, which has done a pretty good job, not a great job, but a pretty good job on air pollution, the reduction in life expectancy is a little bit less than a year. And air pollution is most severe in low and middle income countries, India and China, some places in the Middle East, as shown in this map, and then in this hemisphere in Haiti and in Guatemala. The health effects of air pollution are many. They were first recognized when we had some big air pollution disasters in the middle of the 20th century, Denora, Pennsylvania, the Great Fog of London. And these episodes killed hundreds, even thousands of people within a few days, with more deaths in the weeks and months afterwards from delayed disease. And what these episodes did was that they really alerted the general public and the health professions to the dangers of air pollution. They jump-started the field of environmental health, and they resulted in the passage of national air pollution laws in many countries, including the Clean Air Act in this country of 1970. So here's a picture of the London fog in 1952, which really wasn't fog at all. Well, there was fog there. There was some water vapor in the air from the Thames River, but it was mostly pollution from coal burning fireplaces in people's homes in central London. And thanks to a whole series of studies that have been conducted over the past 40, 50 years, we now know a whole series of health effects that can be ascribed to air pollution. So heart disease, stroke, chronic lung disease, hypertension, diabetes, and possibly even dementia are triggered by particulate air pollution in adults. And in kids, we know that it causes low birth weight, premature birth, stillbirth, asthma, and IQ loss. We just recently completed some work at BC in collaboration with people at Boston Children's, showing that early life exposure to air pollution is definitely correlated with loss of IQ. So clean air legislation in the United States, we passed the Clean Air Act in 1970. Richard Nixon was president. And what the Clean Air Act did was it set state and it allowed states to set regulations on mobile sources, which are cars and trucks, and on industrial sources. And it also authorized standards that set the micrograms per cubic meter of PM 2.5 and ozone and NOx that are allowed in the air. And it also set compliance deadlines, meaning that if a city or a state failed to comply, they could be penalized, and they were. The Clean Air Act was amended in 1977. It was amended again in 1990, and it remains the principal law in the United States today. And it's been a huge success. I don't think people recognize what a big success it's been, but this is Cleveland, Ohio in 1968, the year that I spent my internship at Cleveland Metropolitan Hospital out there. And this is what the air looked like in Cleveland. You could taste it. On bad mornings, you couldn't see down the length of the corridors inside my hospital because the air was so bad. And this is what Cleveland looks like today. That's the Cuyahoga River in the foreground. Some of you may recall that in 1968, the Cuyahoga River caught fire. It was so polluted with petrochemical waste that it burned out a bridge from underneath. Today, people kayak on it. So we have done a marvelous job of cleaning up pollution. We know how to do it. And the Clean Air Act also got lead out of gasoline, which has made a whole generation of American kids more intelligent than otherwise they would have been. Now, we've all heard the trope that pollution control kills the economy, that slowing the pace of climate change is going to cost jobs. That's a lie. It's just a lie. And here are the data to prove it. This graph, which covers the years 1970 to the near present, shows that air pollution, which is this line here, has come down steadily. Total decline of 77% since 1970. And then look at this green line here at the top of the graph, this one going up, up, up. That's the gross domestic product of the United States, the GDP, a global measure of the health of the American economy. And the GDP has grown by 250% at the same time as we've reduced air pollution by 77%. So it's just not true that controlling air pollution kills the economy. And moreover, it's good business to control air pollution because every dollar that we have invested in air pollution control has yielded an economic benefit of about $30 in two categories. First of all, reduction in healthcare costs, and secondly, increased productivity of a healthier, longer-lived, more robust society. However, and here's a note of political caution, progress against air pollution is neither automatic nor inevitable. In the first Trump administration from 2017 to 2021, the administration tried to roll back 104 environmental regulations, as I'm sure you know very well, including air pollution standards. So withdrawal from the Paris Climate Treaty, weakening of the National Environmental Policy Act, relaxation of emission standards from coal-fired power plants, which allowed coal-fired power plants down in Ohio and West Virginia to put more coal smoke into the air, which of course drifts northeast and comes up here into New England. And then they relaxed air pollution standards for cars and trucks and buses. And all of that had negative impacts on human health. So our team at Boston College did an analysis, which was published in 2021 in The Lancet, a big medical publication out of the UK. And you can see that air pollution, that deaths due to air pollution had been coming down here, down, 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 with a few little bumps until 2017, and then bang, up they rose again to levels that had not been seen in 20 years. And we calculate that approximately 20,000 unnecessary deaths occurred in the first Trump administration due to their rollbacks. And we all know that the Trump team were not as well organized 4 years ago or 8 years ago as they are today. And we also did a state-by-state analysis. And ironically, the states that saw the most deaths due to those rollbacks were states that voted for Mr. Trump, highlighted here in dark red. Coastal states on the two coasts, east and west, were relatively protected. And I think that reflects a couple of things. It reflects the fact that we have less heavy industry than the middle of the country, but it also reflects the fact that we have strong state-based programs, which at least partially buffered the impacts of those federal rollbacks. And here's an analysis of red states versus blue states, showing pretty much the same thing. Sadly, ironically, all the states that suffered the biggest increases in deaths due to air pollution during Trump 1 were red states. We've also done an analysis of air pollution in Massachusetts, looking at the disease and death caused by air pollution in every single city and town across the state. In Massachusetts, we put about 1 million tons of pollution into the air each year. And of that, 2/3 of it comes from mobile sources, about 1/3 from stationary sources. 95% of it, whether it's mobile or stationary, comes from the combustion of fossil fuels. And we got the data from from Mass DEP on PM 2.5 levels by county. The cleanest air in the state is in Worcester County. The dirtiest air is in Suffolk County. The average across the state in 2019, which was the year we did the analysis, was 6.3 micrograms, which is below the old EPA standard of 12. It's even below the new EPA standard of 9, but it's above the World Health Organization recommended guideline, which is 5. And then we calculated and we reckoned that air pollution was responsible for between 2,400 and 5,800 deaths in Massachusetts per year. And it's probably a little bit higher today. We need to redo the analysis. But so we're not as badly hit as Ohio. We're not as badly hit as West Virginia. But we still have probably about 3,500 deaths in round numbers every year in Massachusetts due to air pollution. The majority due to heart disease and stroke, followed by lung cancer and chronic lung disease, and then deaths of infants from stillbirths and low birth weight accounts for the balance. 1,700 due to cardiovascular disease, 2,200 to lung cancer, 200 to stroke, 350 to respiratory disease, 321 low birth weight babies, and 15,000, almost 16,000 cases of childhood asthma. We also did a calculation of IQ points lost due to air pollution, and we found that air pollution was responsible for the loss of nearly 2 million IQ points across Massachusetts. That's a lot of brain power that we're giving up due to air pollution. That's an average of 2 points per child. And we saw these impacts in every single city and town across the state, rich or poor, black or white, east or west, Cape Cod or Boston. Every single city and town across Massachusetts had disease, death, and IQ loss due to air pollution. That said, and not surprisingly, the highest rates were in some of the poorest, most minoritized communities. So the recommendations that we made in that report is that Massachusetts, the United States, need to really move as rapidly as possible away from fossil fuels. And if we do this, of course, we're going to get a double benefit. We'll slow the pace of climate change, and we will also clean up the air. One specific suggestion for cities and towns of Massachusetts is to convert all of the vehicle fleets to electric, like the U.S. Post Office was in the process of doing until January of 2025. Solar panels on the roofs of public buildings across the state. There's no reason we can't do that. It's still cheap. We need to build out public transport in this state. High-speed line from Boston to Worcester to Springfield has been talked about, but we need to get our act together and do it. And we need to put a lot more money into the T than we're putting into the T. We need to preferentially purchase green electricity, revise building codes, and block the build out of the natural gas pipeline network. One of the nice strategies, of course, is the strategy to block gas hookups in new construction, which a number of cities and towns are now doing. And with that, I'll thank you. I'll stop sharing and hand it back to the chair.
Thank you so much, Dr. Landrigan. Fantastic. A lot of great information. We've got 40-something people on the call. Appreciate it. We've got 3 more speakers coming, and Jerry's up next. And I appreciate people's patience. Please hold on to your good questions, and we'll come to them after the speakers. Jerry, you're up.
Thank you, Fred. Wow. You know, I knew most of what Dr. Landrigan covered, but hearing it in this condensed fashion is very striking. How can we reach the diverse people of the North Shore to communicate the essentials of the public health perspective? How can they discover the connection between the source of a toxic substance and the resulting harm and acting to prevent harm? How can we reach busy people who aren't thinking about the climate? How can we create a movement to rebuild and strengthen public health and remedy the systemic sources of pollution? And what's the future for a family like this and their children? A clear blue sky may be full of invisible, harmful pollution. how can we observe levels of tiny invisible particles called PM2.5, so small that they get into the lungs and into the blood? We'll have to use air quality monitors to measure and track pollution in order to protect ourselves. Here, the relatively low air quality values means relatively low pollution in Peabody on April 1st, 2025 at 9:15. Susan and Ron Small are leaders of the MCAN Breathe Clean North Shore chapter, worked with the Commonwealth, Sharon Cameron, the director of the Peabody Health Department, and the city to install several air quality monitors. The area within the circle is centered on the Peabody Peaker, a 55 megawatt gas and oil power plant. And this circle covers environmental justice areas within about a mile of the plant. And that same area is home to a lot of traffic. Route 128, Route 195, and several relatively minor roads that carry commuter traffic every day. Although new state policy should have required an environmental impact study before the peaker plant was built, the Commonwealth failed to require it. And this is the view from my window, where I live just at the edge of that impact area overlooking City Hall in downtown Peabody. So it affects everybody. That environmental justice area was already being impacted by pollution, mainly from traffic. And Peabody had been polluted by the tannery industry from 1639 until 1970. And this Route 128 and Peabody Square. There were already 2 polluting peaker plants in the Waters River Electric Station. Adrian Allen, a physician and with a master's in public health, reports that her North Shore patients say, "I am short of breath. I can't walk." Catherine Rogers, MPH, reported that pollution-related disease rates were higher in the environmental justice areas near the site of the Peabody Peaker than the rest of the state within that circle. Sharon Cameron, director of public health for the city of Peabody Health Department, said that the Peabody Peaker could add an additional 12 tons of small particulates and almost 51,000 tons of CO2. So we organized. We tried to stop the Peabody Peaker to protect immigrants and other environmental justice people from new pollution and out of concern for the climate. We used demonstrations, a hunger strike, education, and advocacy. We had a very broad coalition of organizations and people from all over the state. We even had our state legislators come out and have a good time demonstrating. But we failed to effectively mobilize the large immigrant and environmental justice population or get broad community support. They built the Peabody Peaker, that's the one in the center, as viewed from the MGH Health Center in Danvers. What can we do about it? Well, mitigation. The first step, I think, is know the air quality, and that's where the air quality meters and the whole state is unevenly distributed, but there are air quality monitors all over the state. So you can pull up one of these maps online and see what's happening in your area, moment to moment, day to day. So this map, back from October 17th, 2022, with the reddish circles show harmful levels, or close to 100 micrograms per cubic meter, which is enough to make you sick. So what can we do? We can mitigate with a N95 mask, which conveniently will filter out the particles in the PM2.5 range. And people have to can protect themselves and their loved ones, especially the children and the elderly. And for someone like this girl who may have asthma, a relatively inexpensive air purifier can make a big difference. Can we reach out to both the environmental justice and the middle class communities on the North Shore or wherever you live? Can we explain the health benefits of mitigating against harm by pollution? Can we listen to, motivate, and partner with each group on their own terms? Each group can then mobilize for mitigation and systemic change. To build a movement, we build a coalition. We look for areas of shared values and interests. We enable people to protect themselves from pollution and save their health. We partner together to prevent pollution. We shall protect our health and stop pollution to protect the health of the climate. Are you ready to work together? Can we have a show of hands? Thank you.
Jerry,
We need your
I'm sorry.
Just a couple of sentences. We need your ideas. Let us hear from you. Reach out to me. I'm at Jerry at cleanpowercoalition.org. There are articles and resources at cleanpowercoalition.org. Let's work together. Let's have your ideas. Let's have your energy. And thank you very much.
Jerry, thank you very much for your initiative, which made this whole program happen. And we've got two more speakers. And Tristan, I think, are you up next? And folks, thanks for your patience. You've got good questions, I know, ready. And we will be taking them by show of hands after the speakers are done.
Hi, everybody. I think Emmanuel from the ACE team is going to open us up, if that's okay. I can share my screen if that works, unless you'd like to do it, Emmanuel.
Yeah. Hello everyone. My name is Emmanuel Barros from ACE, Alternative for Community Environment. We're mostly just a nonprofit here in Roxbury, based in Roxbury for the past 30 years. Here in our ACE, we have 4 programs and services that we serve for our members and community folks. But ACE is mostly just a nonprofit that works on environmental justice and based, like I said, in Roxbury. But most of our work reached throughout Boston, throughout the state of Massachusetts, but even region-wide and throughout the nation when it comes to a lot of our policy and advocacy work. But mostly here at ACE, we have our youth program called REAP, a Roxbury Environmental Empowerment project. So that's mostly our youth program, but mostly youth from Boston, and we mostly hire them and also able to have them lead most of our campaigns. With the T-Rise Union, just think of that of member-based transit group that we have here at ACE that mostly work on transit-related issues based off the MTA transit services. But our members are trying to get better services, but also targeting the state, but also the MTA and MassDOT. Here at ACE, we have staff attorney here for years. So we always had a staff attorney that helped us with some of our coalition and campaigns. With that, that's our environmental justice service, our legal services that we have here. And for a few years and off and on, we had our EGEN program, which is mostly just pro bono technical assistance network, but it's mostly our staff attorney that we have here based with the coordinator, but also with a network of attorneys and other organization partners working on case by case cases around the state that are mostly environmental. Yeah, here at ACE, we've mostly been in Roxbury for the past 30 years. Most of our work started back in the 90s. Based in Roxbury, we was the first to have our first how you say air quality monitor system. This was the first we had in the state, mostly by DEP, the Department of Environmental Protection. With that, it's mostly our youth that mostly led some of these campaigns back in the 90s. So back in 2015, we got a diesel emission reduction ordinance that was mostly tackling diesel emissions in the city of Boston. But from one of our youth that was part of the REAP program back in the 90s, due to his fatal death due to his asthma, that actually start a lot of our upward for campaign for clean air in Roxbury. From that, we also have a toxic tour based in Roxbury, and these are the pictures. The first three pictures are mostly features on the toxic tour. When I mentioned the first air quality monitoring, you can see that called Air Beats. We have that that's mostly our second to first stop during our toxic tour. But the bus garage that you see on the bottom middle is mostly Bartlett Yard, how it was back in 2015, 2013 when it was getting demolished. But now currently we have mostly affordable housing and mixed housing there currently at that parcel, and vacant there's some vacant lots in the back that would also be more affordable housing. But now we have Nubian markets, but mostly affordable housing, but affordable food choices for the community that are there currently. And like I said, we was also able to get diesel emission reduction ordinance, but also a building emissions ordinance passed in the city of Boston. So one ordinance trickling building emissions, but the other will track mostly tackling the diesel emissions that we had here in the city of Boston. So that would be mostly vehicles from the city owned, but also top vehicles that were mostly operating at a certain stand. We're mostly with our air quality work. We started off to think about having a way for us to have a community-owned partnership of sensors in Roxbury. So we collaborated with Olin College for this. We saw that Roxbury was the scope for this project, and it was really for the public health, trying to see how the reports that were always released from the Boston Health Commission, but also other organizations and professionals about asthma. But also, we also linked that to respiratory illnesses related to all the way to cancer. And from that, we saw how most of our work from the 90s can actually be uplifted with some of the community engagement work that we have here in Roxbury. So with that, we started by doing some air quality monitoring with our sensors indoor. So with that, we mostly talk to our partners and talk to community folks to find hotspot sites that we want to tackle. But these mostly our building emissions and transportation emissions that we had in the city of Boston. But the scope was really just in Roxbury. And from that, we also did an indoor component, which we gave folks a sensor indoors for 2 months. And with that, half through the month, we give them we mostly just report and give them the data from there. But the other half of the month, so it's either the next 3 to 4 weeks afterwards, we give them an ear purifier to show them the before and after. So after the 2 months or after 6 to 8 weeks with this pilot program inside, they were able to keep this ear purifier indoors to actually make sure the indoor quality was much good for the household. And currently, and so on, as we always did with our work, is mostly taking the reports and data that we use to actually amplify and use advocacy. State House and also in the city of Boston, we use this data. We use the testimonies and use the actions and events that we host in the community to actually uplift our air quality work on the ground floor of Roxbury, but also statewide, and tackling many of the policies in the city of Boston, but also in the state. And this is just a model of how our air sensors look. For the indoor, it was just the one folks that we had able to just plug in through a USB port. But for outside, most of them were operated by a power, or mostly a battery pack that was powered by a solar panel. But some outdoors were powered by a power cord also, if that was accessible for it. And mostly from there, we mostly had a map of our sites, and we just partnered with our youth and actually was able to get a few sites by talking to many of the community folks and building management to get these sites on board around Roxbury. And with some of our example of an indoor pilot program was that with 75 households, we were able to give out 85 ear purifiers in one complex, but also with other individuals that was part of the project also. So we had a few apartment buildings, but also individual households that were able to get these ear purifiers in the indoor pilot. And I'll pass it to Tristan about some of our advocacy work that's currently happening.
Awesome. Thank you, Emmanuel, and thank you to Jerry and Dr. Landrigan. I think what Emmanuel just talked through is an on-the-ground community organization doing the work to address the problems in our community. As Dr. Landrigan's presentation outlined, this is quite literally a matter of life and death and quality of life. And if you wouldn't mind maintaining the slides, I'll just ask you to click through the next couple ones. Appreciate it. Um, and so, ACE, with all we do in maintaining our network of 18 air quality monitors, of giving out air filters to the community and educating people on air quality and mitigation efforts, we are just one organization and we are just, based out of one neighborhood. And so it's going to take a larger, more cohesive effort to be able to address the air quality issues at a statewide level. For every healthy air program and ACE and Green Routes, there needs to be those kinds of efforts in every municipality. And so with that, I want to just take a moment to highlight a way that folks on this call can engage in that work by helping to advocate for legislation that would improve air quality for everybody. So next slide. So there's two bills. The first one is this outdoor air quality bill. And what this would do is establish a technical advisory committee of experts that we have within the state of Massachusetts, whether it's the Northeastern's and iSuper office, shout out to the resources Yaj just shared in the chat, whether it's the Olin colleges, whether it's the Boston universities. We have experts in the state that can help design robust and thoughtful air quality policies and regulations. And so this bill would require just that. Create a technical advisory committee, which would work to identify at least 8 air pollution hotspots and to set air pollution targets to reduce those hotspots below certain thresholds. And what those thresholds would be determined by this panel of experts. This bill would also require the Massachusetts Department of Environmental Protection to track and publicly report air quality data in real time. This is especially needed given of the attacks on the EPA and the ways that federal air quality monitoring is being dismantled. And finally, it would also require air filtration in buildings near those major pollution hotspots. And so this bill was really just a first step in designing more comprehensive, cohesive, and impactful air quality policy for the state. But I believe that we have the technical expertise and enough of a urgency to push for this. The next bill, next slide, please. The next bill is focused on indoor air quality, and it has a similar model to the first bill, which is creating a task force of experts that would help design guidelines and regulations for addressing indoor air pollution and mold. And this bill would focus primarily on high-risk buildings to begin with. So thinking about buildings like schools, childcare centers, nursing homes, and public housing, and overall would provide resources and assistance to folks looking to address indoor air quality impacts. And so the way that you all can get involved in promoting this bill is by scanning the QR code either on this screen or there's also the next screen. And these slides, as Fred noted, will be circulated with everybody. So this QR code, if you want to take a moment to scan it, will take you to this doc, which I'm dropping in the chat, which is an evolving living document that the coalition that ACE is a part of, called the Environmental Justice Table, which is a coalition of environmental justice organizations, primarily convened by those that are community organizations that serve environmental justice communities, but also a number of allies that are in the environment space. The EJ table is pushing on these two bills, and we have this living document which lets folks know how they can engage and support the campaign. So if you open it up, you'll see that there's current action opportunities where folks can reach out to their legislators, asking them to co-sponsor it using this automated form. There's also action tool kit, which has fact sheets on the bills, but also has a document on how folks can call and reach out to the legislators to ask them to sponsor the bills. It also highlights upcoming events. We'll have one this week. One of our allies, Green Roots, will be hosting an air quality data dashboard launch at their offices in East Boston, or Chelsea, excuse me. And then we also have an upcoming event on World Asthma Day, May 6th. And so I'll conclude with, again, thanking Emmanuel, Jerry, and Dr. Landrigan for highlighting the urgency of addressing air quality and air pollution, describing specific ways that organizations are currently working to address it. And I hope that you all will take advantage of the resources I dropped in the chat that we'll be receiving in follow-up emails to engage in our campaign to support our work as individual organizations, but to also institute a statewide policy. So yeah, thank you, everybody.
Thank you, Tristan. I want to also thank Mary, in addition to Tristan and Jerry, for putting this program together. Awesome work. I hope everybody can see how it all hangs together. It's all one big discussion. And thank you, everyone, for your patience. Let's try to take questions for Dr. Landrigan first. But as we said, we'll stay on this call after 1 o'clock. So hands up, please, electronically with your questions. Go to React. And hands up. I'm sorry, react and then raise hand. I think that would be it. So I'm going to look for the first raised hand. Do I see one? Any questions for Dr. Landrigan first, please?
Kavita from Lexington.
Hi. Hi, thank you for putting together this great set of talks. I have to say I joined partway through Dr. Landrigan's talk, so apologies if we covered this before I came on, but it was very fascinating. Dr. Landrigan, how did you show direct causation of air pollution as being responsible for cardiovascular disease, stroke, and lung cancer? I mean, given that the causes for these types of diseases are multifactorial, including diet, exercise, so many other causes. In lung cancer, we don't even know some of the causes when it's non-smoking related. Wondering how you were able to show causation in.
And is this a plug for your course, Dr. Landrigan?
And just I live in Lexington. My career is in oncology, drug development, and pharma.
Yeah. So basically, cause and effect relationships linking air pollution to heart disease, stroke, lung cancer, stillbirth, low birth weight, were all ascertained through multi-year prospective epidemiologic studies, most notably the Harvard Six Cities study, which looked at 20,000 people, followed up with the American Cancer Society study that looked at 155,000 people across the United States. These cause and effect relationships are very firmly established these days in the biomedical literature. To be sure, as you say, Kavitha, all of these impacts are multifactorial, smoking, diet, and other factors all influence. But there's a very clear signal in the data that air pollution causes every one of these effects. And the way we calculated the burden of disease and death in each Massachusetts city and town due to air pollution was we basically used the algorithms that have been developed through the Global Burden of Disease study out of the University of Washington and Seattle, and we applied them to the population of every city and town in Massachusetts. I'm going to share my slide for a second and show you one thing here that you might be interested in taking a look at. If you take a look at this slide here, there's a link. That link will take you to a website that we have built at BC, at Boston College, linking levels of air pollution in each city and town in Massachusetts to disease and death from air pollution. And you can click here. There's an interactive map. Let's click on Peabody, where Jerry is, if I can find it. There's Reading, somewhere up there. We'll look at Reading since we've got Reading. And you can see that the data are popping up for the city of Reading, showing that in Reading in 2019, there were 45 cases of pediatric asthma, 5 deaths from heart disease, 6 cancer deaths, a stroke death, a low birth weight case, and almost 10,000 IQ points lost due to air pollution. And that's in Reading, a relatively affluent suburb. So you can see that air pollution in Massachusetts does not spare anybody. And then, of course, when you move into the urban neighborhoods in the city of Boston, things get even more intense with 1,800 cases of pediatric asthma, 120 deaths from heart disease, 175 from cancer, and so it goes.
Thank you. I'll be sure to check it out. Would you mind sharing the references for?
I dropped it into the chat, and it should be able to retrieve it from the chat.
For the studies, the big studies,
Yeah.
Okay.
Well, the big studies that you want to go into Google.
Yeah.
And look up the Harvard Six Cities study. It's been heavily published. The principal investigator is a superb scientist over there named Douglas Dockery.
Great. Thank you.
I think Michael has his hand up. Or had. Michael, you still there? Oh, you're muted. Still muted. Oh no, you're giving up. Okay.
So Michael, if you want to put your question in the chat, I can read it out for you.
Great. Next hand raised.
And Fred, we are at 1 o'clock.
We are at 1 o'clock. We will continue. Oh, Downing, go for it.
Yeah, I just wanted to say that the indoor and outdoor air quality bills have a lot of support this year from our allied organizations. They are 2 out of the 5 top priority bills for Mass Power Forward that MCAN is a member of. And for 350 Mass that I do a lot of work with, it's 2 out of the top 7 bills, top priority bills. And they're also top priority for Sierra Club and Mothers Out Front. In addition to, of course, the EJ table that I think Tristan mentioned. So I think they have a lot of traction this year, and we should really, they've been around now. They were one bill that's been around for 4 or maybe even 6 years now. So this should be the time to really push heavily for them.
Terrific.
I think you can make the case that those bills were never more important than this year. As the federal protections are being rolled back, we have to take matters into our own hands here in Massachusetts and protect our citizens.
So thank you for mentioning that. And Tristan, you touched on it also. And I just want to mention too, if it's any reassurance to folks that MCAN, the brief phrase is, we're still all in. That's to all climate goals that we have been committed to. That includes all environmental justice goals. So, the question of what's going to happen now with federal government going away in so many different directions, it's a question in so many different directions, is what I want to say. But we're going to stay committed. We're all in. All right. More questions. Judith, is Judith still here? She had questions earlier. Margot.
Hi, thank you. Can everyone hear me?
Yes.
It seems to be working. Okay. My question is, ironically from Reading, thank you so much for providing that information, is we are currently, I guess, discussing or arguing with MBTA. They're interested in putting a turnback in Reading in order to be able to increase service between Reading, I guess, Wakefield, Melrose, et cetera, into North Station. And that's going to increase the idling time substantially. And they're planning on putting it right now. They've decided they want to put it right next to a bird sanctuary and right in between a couple of wetlands. So obviously everybody's is quite concerned. And my question is, in terms of how we're fighting this, we've got some information with regard to decibel levels and the noise pollution. And where would I go to identify the information for particulate matter from? I did notice that Tristan and Emmanuel had some information on particulate matter, and of course Dr. Landrigan was discussing particulate matter in specifically in order to add that to our argument. We've discussed it generally.
These are diesel train engines, right?
Correct.
Yeah, so diesel exhaust is nasty stuff. It's got high levels of particulates. It also has other compounds, notably formaldehyde in it. And the World Health Organization has come to the conclusion, based on good epidemiologic studies, that diesel exhaust is a proven cause of lung cancer. So it's one of the things that MBTA really needs to do. We certainly, I think, in the abstract, it's nice that they're talking about increasing service, getting cars off the road, bringing more people into the city by train. But it's high time that they did a serious study about getting away from those old polluting diesel engines and moving to electric. The commuter trains in New York City are electric. The commuter trains in Philly are electric. There's no reason that Boston couldn't make the switch. And to be sure, there's an upfront cost to doing that, no question about it. But there's a huge long-term saving, because as I've said before, every dollar that's invested in the control of air pollution yields a huge positive return on investment by virtue of keeping people healthy and out of the hospital.
Great.
Okay, yes, perfect. Yeah, we have been, again, we've been discussing it with them. And I guess part of our concern is we certainly support, we have a lot of commuters from Reading. And certainly the MBTA is trying to increase, as those of us who attended the last program with the MBTA, they are trying to increase the number of riders and ridership. But it's just particularly the location next to a bird, right in the middle of a bird sanctuary, wetlands. It's a very highly populated area as well in terms of houses, literally 100 to 200, 100 feet away from this whole area, and literally right on top of a bird, right between the bird sanctuary and the wetlands. So our concern is, you know, obviously, is there a better place, or yes, let's do, let's change it to electric. But I guess one of the things that they brought up at the last session is how difficult it is. They don't have the funds or the resources, and I don't really see why they would not, given the fact that the, you know, Mass government supports it.
Great.
But
Okay, thanks,
thank you.
Margot. And Maria and Susan, after Maria, Susan.
Hi, I have a question for Tristan about the outdoor air quality bill. One of the things I heard last time was actually Senator Barrett was saying, oh, we don't need this because we already have so many air monitoring devices that, and I don't really think that's true, but I'd like some more ammunition for adequately dealing. I understand it also talks about a committee, but just the number of air monitors, how this would change what is already what we're already doing. Thanks, Tristan.
Yep, that's a great question. So most of the air quality monitors, to my knowledge, are sort of privately / community organized. There really isn't the comprehensive state level effort. DEP does maintain some level of air monitors. However, my understanding of the science is even on one city block, there can be great differences in air quality based off of the air pollution sources. And so even if we had 10,000 air quality monitors all throughout the state, we would need a system and a process to be moving them around to ensure that we're capturing all the potential air pollution hotspots. And so that is why we need a more comprehensive statewide effort.
And I'll chime in and say I agree with that entirely. And the last time I looked, there were roughly 20 official monitors across the whole state. 20.
Thanks so much.
And may I add just briefly that in terms of getting citizens aware and able to know what's going on so they can take care of themselves, it's very helpful to have a monitor close by where you live and work. And they're not that expensive individually. You know, it could be $300. You could put one up in your home, someplace off your home. So that, in Peabody, we've got 7, and I rely on them constantly.
One thing people can do is log on to something called the Purple Air Network. Purple Air is a company that sells these monitors for $200, $300, like Jerry says, and the information that they collect is uploaded continuously, and there are now hundreds, if not thousands, of them across the state. It's a fairly dense network, and you can log on. It's open access, and you can find out what's going on in your community. A couple of years ago, when there was a big fire in a hazardous waste disposal site down in Braintree, the first signal that pollutants were increasing in the air down there in Braintree and Quincy was the Purple Air Network, which picked it up way before the state monitors did, simply because there are so few state monitors.
Amazing. Susan.
Yeah, hi. I two things. I'm curious about an response to the question that Kelly S. put into the chat related to agriculture, but I also wanted to ask if one of the most difficult arguments that I come across is when people talk to limit the transition is related to embodied carbon. That, you know, people say, oh, don't replace your vehicle, or don't put in new infrastructure because of the embodied carbon of the new equipment. Does anybody have a comment about, or have any data about that would help counteract that question in terms of, you know, you have relatively high functioning older equipment, and how do you justify given the embodied carbon?
Right. So I'll give a short answer, but there's longer answers out there. And I'm sorry I don't have the quantitative side of it for you, but you know, the general approach that the climate movement has been taking for years is when it's time, when your natural time to retire something comes around. In other words, if you are ready to and have to buy a new vehicle, If you have to buy a new vehicle, make it electric. That doesn't solve all the questions you're asking, but it's a general guideline. If you have to buy a new vehicle, make it the right kind. In terms of uh, buildings, tear down or reconstruction, there is a general approach to evaluate the embodied carbon if you maintain the old structure. There isn't a hard answer as to which path to take, but now there's good tools to use early in the stages of when those questions are being asked, um, that can address it. So MCAN is actually working on the question of building embodied carbon, especially in buildings, and we will get back to you, get back to the network generally in the next few months with new tools for embodied carbon questions. Thanks for bringing that up. Did that address your question there, Susan?
Well, I
Or
was
and you
actually,
also were asking about agriculture.
yeah, I was going to say that my embodied carbon question was, I was thinking more about like the public transit and, you know, the kind of larger projects that we want to see replaced, because I think a lot of those are still very functional. And so that was really more my concern than individual residential kind of actions. But I guess it just has to be evaluated on a case by case basis. But then the other question that Kelly put in there was about contributions to I think climate and particulate issues from agriculture. I live in a farming community. I don't know where Kelly lives, but but I think there's a lot of questions about farming, traditional versus, no-till and things like that. I'm wondering if anybody has any comments about that.
Dr. Landrigan, might you have any thoughts?
No, sorry, that's not my strong suit.
Susan, while you're on it, do you want to share anything, any personal anecdotes?
Well, I mean, where I live, there's concern about PFAS and certainly and on microplastics. But I think Kelly's question was really about, I think she was really looking more at food consumption and kind of plant-based, converting to that. But I know where I live, like, trying to get the farmers to follow organic practices where they're not allowed to spread sludge and things like that. But that's I think off topic for this forum, because I don't think that's as particulate related. So
I have a question for you, Dr. Landrigan, if I may. I was intrigued. This is the second time I heard you say it. But the 1952, I think, was the year London smog event, London fog event. And by the way, so I'm old enough to remember particulate smog, particulates and smog. My kids were amazed when I told them I would walk around New York City wearing a white shirt, and I'd come home and it was speckled.
Mm-hmm.
And my kids are amazed. Okay, but my question is this: so I think you said that event or the I don't know if you can generalize it, but that it came from all the buildings, or particularly came from all the buildings. Maybe you said homes. They were burning coal. So my question is a little bit: why was this a peak event or a regular event? And is there an analog? The reason I'm asking this is that there an analog today? Because until recently, we could say all homes in the Northeast are heated by gas or oil or propane. And it's no longer coal, but it's all. And now we're making inroads on that. But is there an analog there in terms of how prevalent the coal was at that time and how prevalent fossil fuels are today?
Yeah, so what happened in the London fog in 1952? It was in the wintertime. And of course, the Thames River runs through London, and in the wintertime, the water temperature is warmer than the temperature of the air on most days. So there's always fog coming off the Thames. And so long as there's wind, that's not a problem. It dissipates. But on those 4 or 5 days in 1952, they had a big inversion. The air was still, there was no wind. So So you had those underlying conditions. And then what really caused the disease and death was that back then in the 1950s, pretty much every home and every building in London had its own little coal stove. I was a graduate student in London in '76, and we still had a coal stove in our house back then, and you could go down to the corner store and buy 10 pounds of coal to keep your home warm for the winter. And that was common practice. What happened in the aftermath of the 1952 disaster, which ultimately was responsible for an estimated 12,000 deaths, was that they put strict restrictions on coal burning in central London. And at the same time, they passed national clean air legislation for the UK, similar to the Clean Air Act over here. And it's greatly cleaned up the air. So the fuels that we're burning in New England today, the gas, the oil, the propane, they're certainly not as polluting as coal, but they're every bit as powerful as coal in terms of contributing to climate change.
Right. And I guess as activists, I'm asking another layer of question, which is we tend to think there are larger sources of pollution somewhere, larger than our own individual homes, whether it's multifamily or single family detached. But in the aggregate, the homes are huge, are way larger than anything else.
Well, okay, we emit about a million tons of particulate pollution in Massachusetts each year. Roughly 2/3 of that comes from vehicles, from cars, trucks, buses, trains, and airplanes. And so the biggest bang for the buck comes for getting cars off the road, or getting, I should say, getting gasoline burning cars off the road and replacing them either with electric cars or clean public transit. The remaining 1/3 comes from stationary sources, which includes both homes and industrial sources. And another big reduction in air pollution would come from heating more and more homes with clean electricity that comes from either wind or solar, no question.
Any other questions? This has been a great presentation. And I really appreciate everybody's contribution and everyone's patience. And Michael, you did have a question before. Did we end up covering it?
It's been covered. Thank you very much.
Oh, fantastic. Fantastic. Thank you, everybody, for being here today. Really appreciate it. Jerry has a final word.
Last question. Dr. Landrigan, you're probably you are the most experienced person in the group. Without exposing yourself to retribution from the president, what's your advice? What's the best way or ways that we can recover the progress that's been won over the last several decades, and that the government's trying now to take away?
Make your voice heard in the short run and vote 18 months from now.
And shall we be supporting the bills that Tristan laid out for us?
Absolutely. Absolutely. Yeah, because we, as has already been said, as Tristan pointed out very eloquently, we can make a difference here in Massachusetts by supporting these bills, and that will at least partially buffer the impact of the federal rollbacks.
And let's work in our communities.
Yeah.
In any way that, any small ways or community-wide ways that we can. This is all hands on deck.
Hear, hear. Tristan, any final words?
No, thank you everybody for participating and listening, and don't hesitate to reach out if you'd like to learn more and engage on our campaign for the bills. I'm going to drop my email in the chat.
Thank you. Tristan. Thank you, Emmanuel. Thank you, Dr. Landrigan. Thank you, Jerry. And thank you, Mary. And thank you, Phil, for keeping all the wheels in the back room working.
Mhm.
Thank you, Fred.
Thanks,
Yeah.
everybody, for
Bye-bye.
making this work.
Yeah,
Bye-bye.
thank you very much, everybody.
Jerry, I'm dropping your note taker, unless you can
Yeah,
turn it off on
it
your end.
died. It died halfway. It
Well,
shut off halfway through. They wanted more money. I'm sorry. I'm such a newbie. I screwed up at the start, and I'm sorry for that little glitch.
It was a great presentation. I'm so glad it came together and I think we rolled with it and there's some really good presentations. Thank you, Jerry, for your contribution. Thank you so much.
I'm so happy that we're able to do this, and thank you everybody for the cooperation and support and just for doing this. And isn't Landrigan something else?
Yeah, totally.
Isn't it? He's just amazing.
Well, you did really well. I want to say you came through and Tristan came through and Manny came through and I felt
Tristan, yeah.
having the team with the unbroken team really, I was really glad we ended up doing it that way rather than breaking up the questions. The questions were great and I'm so proud of Fred and the way he handled it. Thank you, Fred. So
Hey,
much.
thank you, Captain Mary.
Mary,
Yay,
you did a
It's
great
my job. It's my job.
You did such a good job, and we owe you for all the worrying and harassing and herding of cats that goes with the job.
Indeed.
Well, it was a learning experience and I just appreciate the support to go with what we ended up with. I think it worked out really well.
Right.
I feel inspired. I feel really inspired. And Jerry,
That's
your
great.
presentation was
Margot,
really.
are you there, Margot? Margot, are you there?
Yeah, sorry, still here, just taking notes and enjoying the conversation.
Hey, listen, I'd love to hear any final thoughts from you.
Oh, well, in terms of the program, I thought the program was fascinating. I was actually I jumped on one of the climate change, or no, one of the air quality things. I think it was the one, Jerry, you may have sent out. And I was doing a comparison between Peabody and Reading.
Yeah.
Between the two, which was fascinating because, in fact, I just thought, okay, well, he mentioned how Peabody is not in great shape, and apparently Reading's not in very good shape either.
What's the reading there today?
Well, that I don't know. I didn't actually take a look at that, but and maybe I was in the wrong spot. But I was doing the looking at the PM 2.5. Which is apparently quite similar. It's the same both in Peabody as well as in Reading, according to whatever it was I was looking at. And even though like Reading has higher levels of IQ points lost, Peabody has higher levels of, I guess, cancer and cardiac issues. But they were both at 6.57 or something like that for PM 2.5. I was just, trying to figure out how it all works. I mean, these things are just fascinating and you need hours just to go through all of them, I find.
It is interesting. Yeah, and I you may need to do some community organization and protest. Let us know if we can help. Studi and Ron Smaller, as I mentioned in the talk, were able to get air quality monitors installed. There were some paid for by the state, and then the city, the health department and the city put them in. I don't know how they did it. They managed to spend a lot of money making them work and run. But I think if you have your own home, you could put one up in any place on your property or hanging off of a window, and
So-
you shouldn't be more expensive than just buying the device.
Yeah, and
Marco,
that sounded great too, that whole purple air network, that
Yeah.
was really fascinating as well, yeah.
Marco, can I ask, and I'm sorry, I should know probably, but in Reading, what is the group and how active?
In terms of what's going on with the
Is
MBTA or?
well, or that or a climate group?
But we have a variety of different in Reading. We've got a number of again, different, I guess, teams or programs that are affiliated more with the town. Pop Huddle is one of the organizations, but it's more politically focused. They're the ones.
Which one are you most involved with?
Well, I work as part of I work with the town forest committee,
Ah.
providing information on, conservation things and stuff like that. I'm finishing up a certificate at the Mass Audubon, on conservation, and that sort of information. I was involved with some of the class. I actually just went to a program the other day on this whole MBTA issue, as well as the new Killam School that they were talking about. And one of the, because one of the things we've been attending is a lot of the embodied carbon, at least I've been attending a lot of the embodied carbon programs. And I always find myself to be somewhat, I feel out of place because I'm not an engineer and I don't know enough about that aspect of it, I guess, when they start talking numbers and throwing things around at these meetings. I did ask them though, about that, and they one of the things that they claimed was that you have to, I guess the building had to be taken down as opposed to being, having a chance to go ahead and renovate it, because it was so old and, this, that, and the other thing. And in order to be able to get the funding we got something like, I don't know, 40,000 or 40 million or something like 47 million to, yeah, $47 million in order to build a new school towards that. So that left less that we were going to have to do, I guess. But in order to do that, whatever board it was required that, it wasn't a question of renovating it. It was a question of, building a whole new school.
What was the vintage of the old school? Do you remember?
Let me see. It was the Killam School. It was after the Pearl Street School was closed. I would say back in the 50s, 60s. I
Right.
think
So
it was.
yeah. So I mean that's not an uncommon story, right? So the buildings of that era, were they built to last as buildings before them might have been? That's one question. Were they built?
Right.
Could they be upgraded to modern standards? Energy is just one of them, but educational standards, as you know. So yeah, so MSBA deals with those questions, and
That was
hopefully
it,
they're dealing with them.
MSBA.
Right, right. Hopefully they're dealing with them better than they used to. I know they've made great strides in their energy and carbon requirements. But yeah, it's a tough business to make that call between tear down and and rebuild, because if you've got a shell, it's a lot like rebuilding anyway. And when you rebuild to the shell, within the shell, are you able to get the classroom sizes and the energy efficiency that you really want going forward? It can be really tough to get there.
Yeah, it was interesting too, because I know they're planning on moving all of the preschools. So they'll be consolidating all of the preschools over at the Killam. So that's going to go on like the first floor or something. And then they're going to have an area for disability classes. So that's also going to be at the Killam School, which will be, community wide. So it looks like the Killam is now 3 stories. It was just one story before. So now it's a 3-story mega building, which certainly you wouldn't have been able to, I imagine, renovate the older building in order to accommodate another floor on top of it and one below it.
So that's a very important point. So if you can, what's the right word? Densify, make, and that's what you're talking about here. It's not
Yeah.
right. It's a
Yeah.
denser usage. that makes a huge difference in the embodied carbon balance. So even though it might hurt, or be painful, I should say,
Yeah.
as carbon goes, it sounds like that's where it should go. That's the
Well,
direction.
there's another question that needs to be addressed pretty early in the planning,
Okay.
is to have the architects and engineers who know about doing efficient kinds of structures that in the long run will be healthier to live and work in, and also save a lot of energy.
Do we know what the heating system proposed is?
No, I don't. They didn't actually go into that level of detail at the meeting. They're,
Well, we're having this discussion today, but I wouldn't know where you are in the long arc of construction. But generally speaking, in new construction, ground source heat pump is far and away the most advantageous. People complain it's quote expensive, but the alternatives often are more expensive. So in terms of life cycle costing. So I don't know if there's still opportunity for input. If they're not talking about it, that might mean they're still considering. So
they are
good luck.
definitely, I mean, they're at the point where, I mean, basically they have a proposal, they've put it in front, or at least they're planning on putting it in front of the town. They were discussing that aspect of it, and then the town has to vote, the people will be voting on it, but they haven't, and I do have to go over to the, back to the Killam pages, I guess. I kind of dropped the Killam pages to get into the MBTA pages. Not that I'm close by, but obviously it's going to affect the wildlife and the town and the people who are directly in the line of the train where it's going to be having that turn back right there. Yeah, 'cause
Right, and as you were saying,
from like 4 hours to 12 hours of idling time,
wow,
which is
wow.
intense for
Margot, you're going to be busy.
I hope so. Yeah, I just need to. If I could just find them to pay, find someone to pay me for it, that would be awesome.
Yeah, you can get what I'm being paid.
I know. I'm already getting that.
Yeah, I mean,
Marco, good luck with it. But it's
Thank you
also
very much.
Yeah. It also sounds like, as you said, there's multiple groups in town, and I presume one or more of them are dealing head on with the heat source question, the heating system question, because that's the biggest carbon question by far in the new construction.
Yeah, my understanding is that the net zero group is working on that, because we do have a net zero group as part of that.
Right.
Yeah,
right.
and they would know about the building
Yes. Yeah.
requirements. And if I remember right, Reading, and forgive me, my memory for names is a sieve. You have or had a city councilor who a woman who was very instrumental in helping us get started trying to stop the DVD peaker.
Huh.
Account.
Okay.
Shoot me your email in the text or my emails in the chat.
Okay.
And I will go through my notes and find out who that person is, and we have experience in frustrating, but we did a lot in terms of organizing and trying to stop the PV peaker. We got other results, we couldn't stop the plant because they were running on, they had snuck through on the old regulation, and we couldn't, we couldn't.
Hey, Jerry, I'm sorry to interrupt, but that reminds me, somebody put something in the chat. I don't know if it was you, Margot, but maybe it was Judith. the question of, I thought we were going to, have whatever alternate fuels for the Peabody Peaker. But the question, I think, tell me if you already addressed it, but do we know how much the Peabody Peaker has already been in operation?
No, they won't tell us anything.
Really?
And yeah, and Sudi Smaller is a bulldog, and she and Ron go to their meetings and ask questions which they don't like to answer. And one of our group got elected to the light board, and of course now we don't hear from her. She got swallowed up by
That's
the
terrible.
I have a quick question. Is Article 97 land involved at all, or your Conservation Commission? I've faced many battles, just even in Brookline, and what you need to do is go to politicians one-on-one and have a walkthrough of the area. For number one, show them what is happening, demonstrate that we've got this problem, but have individual walkthroughs and try to figure out what the state and federal, we don't know, but the state bylaws are saying about protected lands. That is a place to start. I don't know if you've done that yet. I'm talking to Margot, yes, but maybe.
Yeah, I'm sorry, Mary. I didn't realize that. I thought you were responding to Jerry or something.
No, I was talking to you.
Perfect. Yeah, well, we have started to do that. So we've been inviting people from the town manager, as well as people from the select board, and have been showing them the areas. Ironically, MBTA, they purportedly never even officially brought it up to, they've never even sent at this point out a letter to people who will be directly affected. Homeowners who'd be directly affected by the turnback. And I don't know, the sense is that they're kind of trying to sneak this in. There was enough pushback such that in questions, and a video was made. And so now they've gone back to, they've actually pulled it from consideration temporarily, and they're going to be resubmitting it, they said, after reviewing other alternatives. But we think it seems like the select board seems to think that, they have, I guess, the right, they own the property, they own the area, and they can do what they want to do. And there isn't a whole lot that one can do about
Oh, the
that.
T owns the area. The T owns the area.
The T owns area, that there is, I guess there was a track there that they want to kind of recreate a portion of it. And it's right next to it, runs parallel to the one track that goes from Haverhill down to Boston. So they want to recreate that little piece of track that they'd be able to pull the train off of onto, and while they're waiting for the half hour in order to be able to run it, return it back to Boston or something.
Okay, well, there may be an angle to pursue.
Article 97.
I can't see. Article 97 land is there's a new strengthened Article 97 exchange. They have to find another area. If it's Article 97 land, I don't know. They have to find another area to replace the land that they're taking. And that's an important thing that I have no idea. It sounds like it's not Article 97, that if they own, quote unquote, own it.
Yeah.
But what does that mean, and how did they get it? And how old is that date of belonging? And then the MBTA people who came to us are all about climate, and they talked about balancing, not just overtaking land, but balancing the climate agenda. So I would talk to other people at the MBTA.
Lynn,
and I'm sorry.
I wrote Lynn Heffernan's down. She's one of the people that I was hoping to reach out to at some point.
Yeah.
I think her name is Lynn Heffernan. She was the director who spoke. She and somebody with Kat came in and spoke.
Right, Kat was the main contact there for us. But this is the background work of activists that can prevail. And you have terrific opponents. I mean, in Brookline, we had the Youth Hockey League wanting to put, you know, a megaplex the size of a Home Depot on a historic national site.
Oh, my God.
And we defeated it over time, and we still have to build it, but it took 3 years.
Oh, wow. Yeah.
But
well,
hang in there and look, don't leave any leaf unturned, because you don't know where it's going to lead.
Yeah, well, hopefully I can, hopefully I'll be in touch with all of you at some point in order to be able to say, by the way, any other thoughts, or this is what I'm coming, this is the feedback I've been getting, because
Yeah, keep going,
it's
keep
get
going.
frustrating.
Stay in touch too, yeah. So I have a little, since if the three of you wouldn't mind a little 2-minute story, you might be interested, talking about wins and losses and long term. And Jerry, I'm thinking about the Peabody Peak, or how, you know, you have to end your discussion of it, but it got built anyway. So hold that thought for just a second. So who remembers the term the Clamshell Alliance?
I was really involved with that, yes.
I was really involved with it. And Jerry and Margot, in a nutshell, it was the organization that was behind the anti-nuclear power activism, the activism in the 1980s. And specifically and particularly and first and foremost against the Seabrook nuclear power plant,
Right.
which, to tell you the end of this, to jump to the end of the story, got built.
Yeah.
But what I want to say is this, that amazingly, even though it's many decades ago, the documentary of the Clamshell Alliance just was finished and is available to see, just was finished in the last couple of months. So you can look for it online. I highly recommend it for us activist organizers. It's called Acres of Clams, Acres of Clams, and it's very interesting. It's a full-length documentary, but it's very homey. It's nicely done. And it tells the story of you know, the starting and the stopping and the obstacles and the building and the building and the building over years of the Clamshell Alliance. And so you with me, Jerry?
I am, and I'm wondering, is there
I
a
haven't
link,
finished.
or where, when and where?
Just look at him. Right. We should, MCAN might show. No, just look for it yourself. It's fun. It's a fun thing to watch, called Acres of Clams. Acres of Clams.
I was writing it down.
Great. So the point I want to make for the four of us here right now is that, and I'm going to give away the movie. You know how it ends, but that's the point. And so the narrator, the filmmaker, comes back and he says, and so this is where we were in 1980, whatever, and when we got to the largest number of protesters, and then he finally pauses, first time in the whole movie, a dramatic pause, and here's a slide. This is what happened. In other words, he shows the finished nuclear power plant. So we failed. Another pause. Except, he comes back and he says, except, if you think about it, Seabrook Nuclear Power Plant was the last nuclear power plant built in America. And then he lists, you know, like 100 different projects or 60 different projects that were canceled in the years afterwards. And his point is, why were they canceled? Why was this the last one? Because way too much fuss. Way too much of a hassle. If people are going to protest like this, the developers didn't want to have to deal with it. So
good story, and there were good results from the Pika protest, which, and as I told you before, was painful. I couldn't get into the weeds of that, but there's current legislation to try to change the framework of MWIC, which is the group that organized the Pika plant to be built.
Right.
And the awareness of the need for transparency and opening these things up in a transparent way to the public. I mean, the peaker was called the 2015A because it was started in 2015. We didn't hear about it till 6 years later when all the practically everything had been approved. So, you know, the lessons we learned from that is you got to fight it, get in the trenches and fight early, and don't stop.
As early as
Which comes
possible,
back
yeah.
to Mary cheering us all on. Stay with.
Yeah.
Thank you. We appreciate it because that's exactly what I was talking to the group about the neighborhood group, saying that, now is the time, in fact, to go ahead and start organizing boycotts, because if we start organizing boycotts potentially, and the MBTA says, oh, well, wait a second, after Reading, if Reading's not on board, then, it's not possibly going to be worth it. Maybe we need to consider what we're doing.
Yeah,
where we're putting it.
exactly. That's an important tool you have of protest.
Yeah, because that's the whole purpose. The way I look at it is the whole purpose of their doing it, as Lynn was talking about in the program, is they desperately want to increase the number of people. And ironically, my point was, well, they should be moving further north, because you have all these social justice areas, not necessarily for the turnaround, but why aren't we including all of these other communities up through Haverhill in this? Why are we just stopping at Reading and then turning around and picking people up? Because ironically, according to the schedule, every half hour or so there is a train that supposedly leaves Haverhill and just goes, I guess, directly into Boston. I don't know why that is. They don't seem to pick anybody up. There aren't any stops. It's a little weird. Or maybe there are some stops up towards the north, and then it stops at some point and then just keeps going. After 3 stops up north, it just goes directly into Boston. It's like, well, why isn't that being used? Because there are all these people, I imagine big communities that are further away from Boston, more reason to go ahead and take the train as opposed to commuting into Boston, potentially. Why isn't this service being offered to others as well? But I guess one of my biggest concerns is I can't stand the idea of it being in the middle of a sanctuary and next to a wetland too.
Well, the wetlands restrictions are an important tool you have. The wetlands, you've already explored that, the wetlands restrictions.
Yeah, and ironically, right there where they're putting this, they just opened a bit of a park. It was actually part of the MVP program, where they go ahead and they take waterways that are somewhat polluted and polluting, like the Aberjona River or some of the other Mystic River and some of the other things. And Reading just got $2 million, and we cleaned up the access to that area in order to keep it from causing pollution. And they turned it into this nice little park. And right next to this, nice little park, it's just a strip. It's just this little tiny strip, not very large, not very wide, but it's cleaned out. We've cleaned it out of tires and all sorts of pollutants that were sitting there.
Well, parks are protected by Article 97 land.
Okay, so maybe that is, so we can still use that, the parks and the Article 97. Okay. Yep. So again, so that's great ideas right there. Parks and Article 97. And then you said, what was the other thing you said? The wetlands. Well, yeah, because of the wetlands. Right.
Right. And if you have a conservation commission in your town, and you can build with other groups along this proposed pathway and this connection with other cities and towns, you are building your movement.
Yeah, and Conservation Commission has come, they're looking at it now, as is Net Zero and some of the other groups, and I know people on them. I guess I don't know, the select board keeps going back to, when I sit down at some of these meetings, they keep going back to, well, this is their land and they can do with it what they want or something. But it seems to me
that's a cop out. That's like the town manager in Brookline, for example, was for us, and then he was against us once he started to talk to DPW commissioners and people who he works with and their staff under him. So you have to be aware of the town employees who work for the town manager. The town manager is not, seems like, an ally, And then the select board actually hire in Brookline, hire the town manager, and you have to get around them.
Yeah, okay, and that seems to be the case here because they've,
You've got to be very careful.
yeah, the group went ahead and asked, you know, for the select board to go ahead and, you know, take our, you know, take our side, as opposed to like just looking the other way and, you know, just saying there's nothing we can do. Well, you know, might as well just tie our hands. But they haven't been particularly responsive.
Well, get someone to run for select board and take your position.
Yes, we do. Yeah, we have some, we
Okay.
have that's one of the things we're also working on that. We've got an election tomorrow, actually. So we've been throwing the pop huddle and a number of the people have been throwing, I guess, hopefully getting people out to vote for people that have been against the MBTA turnback location. But yeah.
Well, good luck.
Okay,
Good luck in
well,
your.
Thank you
it-
for staying on and, you know, let us know how we keep us posted.
Yeah, absolutely. I will.
Okay.
Thank you so much. I appreciate it. Have a great
Okay.
afternoon, everyone.
Thanks.
All right.
Thank
I'm
you.
going to close this. Good to see
Yeah,
everybody.
thanks.
Good,
Thanks.
good work, Mary. Good work, Jerry.
Yeah, Fred,
We'll see you.
you did a great job.
You
Thanks
did a
for-
great job.
Mary, thanks for pulling it together. What exactly did Phil say when I asked him, what can we do? We said vote, and what was the first thing? I can pick it up off of the recording, I hope.
Let us know. All right. I got to go. See ya.
Thanks.
All right.